It is not unusual that after a long day's work, be it sitting for hours on end or manual work, that you develop a back pain. But what if you mistake what seems to be a common back pain for something more serious? Well, today we'll be talking about a condition that typically starts out as a back pain but could lead to more serious complications. Today's topic is tuberculosis of the spine or TB of the spine, or also known as Pott's disease. What is Pott's disease? Well, Pott's disease or TB of the spine is basically the infection of the backbone or the spinal column by the bacteria that causes tuberculosis. Now, I must mention also that TB typically is known to affect the lungs, but many times could also affect other organs of the body. It could affect the stomach, could affect the legs or the bones, it could affect the brain, could affect the eye, could affect anything. So for today, we'll be talking about that which affects the backbone, TB of the spine. Now, what causes tuberculosis of the spine? Well, it is important to note that tuberculosis on its own is a highly infectious disease and it is one of the top 10 leading causes of death worldwide. However, it can be preventable and if it is discovered early, is generally treatable. So, like earlier mentioned, TB or tuberculosis generally starts out in the lungs. We normally know tuberculosis to affect the lungs, and persons infected by tuberculosis generally present with coughing. But it is not everybody who has tuberculosis who presents with coughing. Sometimes this tuberculosis does not typically affect the lungs. It goes to attack other body systems or body organs, and in this case, it reaches the bones of the back through blood circulation. Now, how do you identify or how do you know that you've got TB of the spine? Well, in the initial stages, it could be quite difficult to know that you have TB of the spine because sometimes you won't have the typical signs and symptoms that an individual having tuberculosis has, which could be back pain, night sweats, weight loss. Sometimes it could just go unnoticed. And many times, by the time that an individual knows that they've got TB of the spine, by then the signs and symptoms could have advanced. So it is always important to know and be in touch with how your body operates, with how your body functions, so that when something is wrong, you have an idea and quickly go and have yourself checked. So, what are some of the signs and symptoms to look out for? Well, in the initial stages, it is quite difficult to know that one has TB of the spine infection because these individuals do not present with typical signs and symptoms such as coughing, fatigue, weight loss, or night sweats. However, after some time, there will be some back pain, which is normally mistaken for the usual back pain. Sometimes there could be a small swelling on the back, a localized swelling which resembles a boil, or in my local language, chipute pamsana. But all these can just go unnoticed because by now the symptoms are not so advanced. By the time that there is a diagnosis of TB of the spine, then the symptoms would have advanced. However, other symptoms aside from the back pain include gradual weakness in the legs that results in difficulties in walking, incontinence, and if you haven't watched a video on incontinence, it is found in one of the videos in my timeline. There it's quite explained in detail. You'd also have some joint stiffness, there'll be loss of joint mobility, and general body weakness. But who is at risk of developing this Pott's disease? Well, tuberculosis of the spine is highly found in individuals who have a low immunity or those that have comorbidities such as diabetes, lupus, malnutrition, cancer, end-stage kidney failure, or also those that heavily drink alcohol and smoke cigarette. And this TB of the spine is highly seen in men as compared to women. How is it diagnosed that one has TB of the spine? Well, there are several tests that can diagnose TB of the spine, and these tests also are there to differentiate different conditions that could also present as TB of the spine. So some of these diagnosis options include an X-ray or a radiograph, an MRI, a CT scan, blood test, skin test, as well as physical examination and history taking. Medical treatment could be given to you if diagnosed with this TB of the spine. And I must mention that the mainstay of TB of the spine management is physiotherapy. And what physiotherapy is going to do for you is that it's going to help reduce the pain, strengthen the muscles using exercise as well as electrotherapy. Some certain postures will be advised that you're supposed to attain so that you prevent complications from advancing as well as rest. So in case you or your loved ones is present with any of the above symptoms, please don't hesitate to rush to the healthcare facility. There you're going to be assessed, you'll be examined, and management will be given to you before further complications arise. Because when left, TB of the spine can actually lead to very serious and devastating disabilities. Well, for today, thank you so much for joining me. Until next time, if you have any comments, questions, or contributions, I will be very excited to read them in the comment section below. Until next time, it's bye-bye.